Hey guys, in this podcast we talk about different health topics. As we're not medical experts, we ask for you to check with your doctor first before using any information provided in this podcast. Furthermore, we talk about the opinions of third parties in this podcast. Please know that we have no intention to misrepresent them, and we apologize in advance if we do so. Thanks. Hey guys, welcome back to another podcast. Different change of scenery, hope you guys like. Paul, what are we talking about today?
So today, what I want to go over is a comprehensive and hopefully an unbiased look at Obamacare.
Okay.
Now, Obamacare is a massive bill, so I'm sure there'll be aspects of it that won't make it into our discussion today, but I want to cover the main points, the main logic behind it, the main concerns with it, and then also talk about what it's attempting to remedy. I want to start out by discussing one of the problems with healthcare in the United States. So, shockingly, and this is surprising to most people, Americans are actually paying more in taxes for their healthcare than many countries that already have socialized healthcare plans.
So what does socialized mean, just for...
So that means that money is taxed to the government, and that money is used to guarantee every person in that country health needs.
Oh, okay.
Their health needs. And what's shocking about that, obviously, is the fact that we don't have a socialized healthcare system. You know, we currently buy our healthcare from, insurance companies and stuff. So why is it that we are spending way more in taxes even for healthcare, but we're not getting free healthcare? Well, obviously not free, but we're not even getting healthcare.
A healthcare plan.
Yeah. And different people have different theories, but I want to go over a couple of the main issues. One issue that we have is something called defensive medicine. Because of the prevalency of lawsuits surrounding doing different procedures, different physicians will typically use different screening tests to make sure that someone has an illness before treating the illness. Not necessarily has an illness, but they want to determine that the problem that the person has is definite, so that they don't do a procedure that's unnecessary and then be at risk of being liable in a lawsuit or something like that. And so that actually causes a lot of excessive spending. It's about $50 billion is what the estimates say. But $50 billion in the scheme of the whole healthcare thing is nothing. That's about 1 to 2% of our total healthcare spending.
Okay.
So that's not the main problem. That's not the main reason why Americans are spending so much on healthcare yet getting so little. Let's
just give an example of defensive medicine. So let's say someone comes in just for a basic flu or something like that. Your doctor might order a catalase test to determine if it's staphylococcal or streptococcal or something like that, or they might order a different blood test, like a hemolytic test or something like that. And what you're saying is, before we had all these legal rules, they would probably just say, oh, you probably have a bacterial infection, it'll probably be clear on its own, I don't need to identify if it's one of these rare, virulent strains, because odds are it'll be taken care of it by its own. But now they might test just in case you have that virulent strain. And if they didn't do that test, then you could go back and sue them or something like that.
Right, and that little extra cost that the test costs is far less than what a lawsuit could eventually be.
Right.
And that's what encourages them to do
and also
additional screening.
Our system is based so that if a doctor orders a test, that's money for them, right? So why, if you were the doctor, why wouldn't you order?
Why
the
wouldn't
test?
you?
Yeah,
and so we can see that plays a role, and that's just a small role. Like I said, 1 to 2% of spending is increased as a result of that.
You said 1 to 2% is $50 billion.
It's $50 billion. That's how big.
So how
this
big is the total we're talking about?
We're talking trillions, in the trillions of amounts per year spent on healthcare.
Yeah, that's almost 5 trillion or 2.5 trillion.
Yeah.
Wow.
So another thing that plays a significant role in causing our prices to be excessive is the tendency that our country has to not negotiate with private companies that make the equipment for procedures. Other countries, there's an example in another video where a guy discusses this, they will ask a list of companies, a group of companies, to make a product, and they ask them to make it reliable and cheap. And whichever company does that most successfully will get to create whatever it is for the entire population of that country.
Wow.
So it creates an incentive for companies to produce cheap,
safe and
effective products, because they have to compete against other companies in order to get these huge contracts where this money goes towards.
Okay, but let me ask you this though. In the U.S., you might have Medtronic or Boston Scientific. Those are big biomedical engineering companies. But aren't they competing the same way? Not all of Medtronic's pacemakers are going to be sold. Maybe some Boston Scientific pacemakers will be sold as well. But don't they have competition too?
Yeah, right. We're not saying that there's no competition.
Okay.
We're saying that the degree of competition is far less. When in other countries, the winner of this competition gets the contracts of all the hospitals, it gives a ton of incentive for these private companies to produce products that are as cheap and as reliable as they possibly can be. So it's not to say that we don't have competition, it's just that we are far worse at negotiating with private companies that make the equipment for that. And
Gotcha.
this amounts for $500 billion in extra spending in comparison to other nations. And this is a huge percentage.
So that'd be 10%.
At least 10%.
Yeah.
You know, I couldn't tell you how much.
Or maybe 20%.
Yeah, it plays a huge role. And, you know, both these things, defensive medicine and our lacking of negotiations, plays a giant role in how expensive our healthcare is. So, talking, like, what we've done so far is identified, you know, why we need some reform in our system.
Mhm.
Well, Obamacare attempts to remedy something that I didn't even mention before, and that's that currently people that have pre-existing health conditions are often unable to purchase health care, and if they are capable of purchasing health care, they do so at incredible costs.
Yeah, so let's say you have diabetes type 2. That's a pretty common elderly type of disease that you get from different risk factors, being obese or diet and whatnot.
Yeah.
There's some genetic components too, but you know, if you have diabetes type 2, then you're much more susceptible to like heart attacks and like strokes and glaucomas, and the list goes on.
Yeah.
So it wouldn't make sense for an insurance company to have you as a customer because you're probably gonna go to the hospital
and be expensive. Yeah.
And be expensive, and that's why they charge higher premium rates.
Exactly. And the other situation that sometimes occurs is that someone won't have health care, and then a serious incident will occur, and then they'll be denied health care from companies, and therefore when they go to the medical emergency room or whichever place that they're taken care of, they're paying, you know, hundreds of thousands of dollars for their treatment,
Yeah.
and it's bankrupting them, putting their families in terrible situations.
Yeah, and the law is there's an EMTALA Act basically for emergency medicine. Law is in the U.S. In order to become an emergency room, the hospital has to accept anybody, and they don't have to. The hospital has to get them stabilized, which is different than curing the condition, but stabilized if they're not going to die. So ultimately, like you can get, and that's really expensive, by the way. When you even stepping into an emergency room can cost at least $800, just the base price alone.
Yeah.
So yeah, that is a more expensive route to treat an emergency condition rather than a condition you could have prevented.
Mhm.
Yeah.
And so why don't we swing back into like what is Obamacare then?
Yeah.
So the basic logic behind Obamacare is that healthy people are going to pitch in a little bit more money so that the sick people don't have to pay excessive amounts.
Right.
So everyone's going to spend a little bit more so that the people with these, you know, pre-existing conditions are able to therefore afford health care, which they weren't able to in the past. So the past situation, you know, if you had a pre-existing condition, you were paying huge premiums.
Yeah.
But now that those huge premiums are going to be steadied by healthy people paying a little bit more money and something called the individual mandate, where everybody in the country is required to buy health care. So I want to emphasize the individual mandate because it plays a crucial role in understanding Obamacare. So the individual mandate is a law passed that says everybody in the country has to buy health care.
Okay. Or
And
has
if
to
they-
have health care. There's a difference. I mean,
Has to
have
have healthcare.
healthcare. Yeah.
And what that means basically is that, you know, in the past you could make the decision to not buy healthcare. And it was a gamble because if you didn't buy healthcare and then something very serious happened, those costs you'd be expected to pay.
Right.
You know, they could be
And they're
thousands.
astronomical.
And they're astronomical.
Yeah.
I mean, that's the only way we can describe them. And so before, sick people often couldn't buy healthcare, or they had to buy incredibly expensive plans. Now if we take all these people who previously didn't have healthcare, along with these healthy people who maybe used to buy bare minimal plans,
Yeah.
and we pull all that money together, then everybody is covered for the same price, regardless of their illness. And the way it worked in the free market, like when the government wasn't involved, is that people who had worse conditions would have to pay more because the insurance company would expect them
To pay
to-
more.
to need
Yeah.
more
Well, okay, but let me just kind of speculate a little bit here. So, I mean, generally, I would guess richer people would be healthier because they have access to more things that would allow them to be healthier. You know, good food, good housing, good conditions altogether. If they had a mold problem, they can hire someone to get rid of it. The list goes on. So, if healthier people are paying for the insurance of less healthy people, couldn't you say this is kind of a way for richer people for giving money from the rich to the poor.
So like a redistribution of wealth.
Yeah.
Yeah, and I'd say that Obamacare is in very much
That is
an
a
ideological
general trend in this.
redistribution.
Yeah.
Yeah, it's very much so that way.
Okay.
It's not completely socialized like you will have in other countries.
Like
but
Canada, for example, right?
Canada, yeah, it's a very different situation than what Canada is presenting.
Yeah.
So understanding the individual mandate is an important part. So all of us are required to buy healthcare. So what happens if we choose not to, buy healthcare?
Yeah.
Then what the current plan is that people who don't buy healthcare will be penalized. And the penalty will be some amount that is less than the cost of buying into healthcare, but not significantly less. So if you choose to opt out, the hopes is that the penalty is high enough where you might as well just pay a little bit more money to get everything instead of paying something to get nothing. One of the concerns right now is that there's no way to actually enforce these penalties.
What do you mean?
So when you choose to opt out of buying healthcare and you're penalized, the only way that the government takes this penalty away from you is in tax
rebates.
Rebates.
Oh.
And so now, so
you'd have to pay more. Like, let's say you have $5,000 for taxes, just to keep it simple.
Yeah.
And you paid $7,000.
Right.
You would get rebated $2,000.
But now you're being fined, so $600 of that $2,000 rebate is now being taken out. You're only getting $1,400.
Okay, I got you. But if you're poor, you're never gonna pay more than you need to for the taxes.
Yeah, we'll also talk because the poor situation is different because the government will subsidize poor people and help
For
them
their
buy
health
this plan.
insurance.
Yeah, so I want to get to that in like a later time, but
Gotcha.
essentially, like so far the penalty is just taking out a tax rebate. So one, many people don't get tax rebates because they don't make mistakes in their taxes, and two, even if they don't get a rebate and that fine isn't enforced, the government at the moment does not have a way to penalize the person further.
Yeah.
So that's a potential risk, but also something that could be easily solved by allowing jurisdiction to be placed upon that person.
Yeah, no, I understand.
So that's the basic logic of the healthcare system. You get healthy people to pay more, you get everybody to pay in, and then these sick people with pre-existing conditions can now be paid for.
Okay.
So the pluses, I want to first go over like what the advantages of Obamacare are.
Yeah.
And then go over what some of the disadvantages are, how they're attempted to be resolved, and further critiques of it. I think it's important that like when looking at Obamacare, we don't assume that the first run of it is right. It's going to take many critiques and adjustments, iterations before Obamacare can be like at its best. And so critiquing it is not a bad thing. It's actually helping to develop it. So I want to go over some of people's critiques and but also discuss the positives and like show like what Obamacare is attempting to remedy. So the first plus is that with Obamacare, each person will be required to have a healthcare plan in which they will get 10 different essential health benefits.
Okay.
So most healthcare plans, depending on how much you're paying, offer a variety of health benefits. You might get yearly visits to an optometrist, to a dentist, to the doctor's office, without copay. These things might be included.
And just copay just means you don't have to pay when you go to your appointment.
When you have to go to the
So you just go for your appointment for free.
Right. So at the moment, before Obamacare was implemented, basically the more you paid, the more health benefits you get. You had the option to buy a plan with nearly no health benefits, but only that would only be there in case of dire emergencies.
Okay.
And these are called like bareback plans.
Okay.
So you're paying like a very minimal amount, and you're not getting yearly visits to the doctor's office for free or dentist's office and all that stuff. But instead, you just get coverage if something terrible happens, like a car accident and stuff. Those plans are no longer allowed under the individual mandate. Now you must get a plan that carries across these 10 different benefits that we're discussing. So one of the ideas of this 10 different these 10 different health benefits is that by giving people better treatment now, then in the future they're less likely to have major medical ailments that are excessively expensive. So like a short example of that would be like dentist appointments, yearly dentist appointments. So let's say that you go to a dentist once a year, and that dentist inspects your teeth and tells you you need to brush more, you need to use mouthwash, floss your teeth more because otherwise you might develop cavities. Well, let's say that you take that advice and as a result you prevent cavities from occurring.
Yeah.
Now let's say you don't go to the dentist, or you go to the dentist once every 5 years. That same advice will be given to you every 5 years.
Right.
And in between that time, you may have accumulated,
A lot of
severe
plaque.
decay, plaque, cavities,
Bacterial.
and the
yeah.
surgeries necessary to remove these things
Is-
are far more expensive than these short visits
Yeah.
to the dental hygienist and dentist.
Even
which are way
without
less.
like a healthcare plan, a dental visit might be $100, $150. Like if you had some sort of bacterial infection and had to remove an entire tooth, that surgery alone right there is at least 10,000.
Mhm.
So that's a factor of 100 right there, right?
Yeah.
100 times 100 is 10,000, and it could even be more.
Yeah.
Right. So maybe 200 times 200. So
Yeah.
just to give you like proportions, and this is a very simple example.
Mhm.
There's many other things that can go wrong.
Yeah, like another common example that's given is, if you have a colonoscopy and they detect potentially cancer polyps that could be removed,
Yeah.
you getting those removed could prevent you from ever getting cancer.
Yeah.
But ignoring those and letting those develop could cost you, hundreds of thousands of dollars in cancer treatment and chemo and, things like that.
Yeah, and another thing too, I just want to say, just as technology progresses, a lot of things like cancer or diabetes, lots of different diseases are being biomarked, meaning that there's different proteins that you can evaluate, or even DNA sequences you can evaluate in the blood. And to just test for those proteins or DNA sequences is super cheap. It might be like $100 or $50. So you could determine a lot of diseases very early on for a very cheap cost, which really helps prevention in medicine.
Yeah, and saves money in the end.
Yeah.
So not only are you
A lot of
saving
money.
people's lives, but you're also saving money. So a couple additional benefits is that children are on their parents' healthcare plan until 26, if they will to. I mean,
Yeah.
if they opt out. I mean,
Unless they get married, I think, right?
unless they get married.
Yeah. Okay.
Yeah. And so that's good for people who are making the transition from college to a career and haven't yet
Yeah.
stabilized a job.
Because
With
if you think
insurance
college,
benefits.
undergrad's 4 years if you can get through it in 4, and then you have graduate school 4. I mean, you're 26 when you graduate.
Mhm.
That's you could potentially get through undergrad and graduate school if
Yeah.
you want to go that far.
And that's why it's been set at 26, is
Yeah.
because it's an age where many people are making that transition and finally are being covered by their
Yeah.
job as opposed to their parents.
Right.
And so that's another benefit. Another benefit, which I think we can all agree is a good benefit, is that insurance companies are required to give rebates when they take your money and they overspend on overhead costs instead of spending on their users' needs.
Wait,
So
so
let me just explain that again. So in the past, an insurance company could take your money
Uh-huh.
and then use that money for overhead costs,
Like management.
like management and
the
things like that.
secretary, all the building.
Yeah,
things
they
like
could
that.
use all that money. Well, now there's a limit to that. They can't use over 20% of the money they get for those expansions, for management payments, and that stuff. And if
wow.
they do, they're
They have to give it
required
back.
to give it back in a rebate form.
Wow, so they can't make that much. That really cuts off their.
It doesn't cut out. This is
Profit.
spending costs.
Oh, not what they take in as a salary. Just what they take in as a spending for like management services.
For overhead costs specifically,
Yeah,
which
right.
is like keeping and managing the company and stuff like that.
Right.
So
Okay.
so they're taking in all of your money. Let's see.
That's really
I
interesting.
did have a specific number, but when they do overspend on overhead costs, they have to give you back the money before that discourages them from making massive expansions with their users' money.
Or using like a private jet or something like
Or
that.
using a private jet,
Yeah.
things like that.
Okay.
They just have to limit that and have to spend back. And so most of us can agree that there'd be some benefit to that.
Right.
There's this thing called the donut hole, and I don't want to get into it. We can actually go into more healthcare stuff in another podcast because I don't want this to take too long.
Mhm.
But it's basically something where when you're buying prescription drugs, at some point the costs start increasing for the same drugs that you're buying.
Well, because you're getting a higher dose.
No, not necessarily.
Oh.
It's just a part of the system.
Oh, okay.
Things tend to increase, and there's this thing that develops called the donut hole.
Okay.
And Obamacare's hope is to remedy that situation.
Hmm.
I don't want to get too much into that today, but we could go over more of that in the future.
Okay.
There's another thing which some people like, some people hate, is that health plans must cover FDA-approved contraceptions, with the exception of religious organizations. There was a lot of anger when this mandate, and it's not really a mandate, when this part of the bill came about because religious organizations didn't want to have to give their employees contraception
Yeah.
if it was against their religious doctrine. So Obama actually, listened and adjusted the system accordingly so that religious organizations wouldn't be required to do
Okay.
that.
I gotcha.
So those are like some of the key benefits, and there's more. This is very complicated, so
Yeah.
I want to stick with some of the key. So now I want to discuss some of the trade-offs.
Okay.
So the major trade-off is that healthy people now have to pay more for their healthcare.
Right.
So people can't buy bareback plans. Healthy people who maybe don't need to go to as many visits can't. There's no reason for them not to take those visits now because they're required to buy these more extensive plans.
I mean, you can kind of look at it as if someone like really takes. I mean, barring genetic disorders, someone who takes care of themselves,
right.
Runs every day or exercise every day, eats a really healthy diet, they have to pay more. I mean, I would still get health insurance even if I was doing all those things.
Yeah.
But I could understand that. And then someone who's just eating potato chips and watching TV all day, it's just kind of unfair for someone to work really hard just to pay more for the guy eating potato chips.
Right, and so that's one of the initial trade-offs.
Yeah.
And that gets into a debate of how many of these illnesses are self-caused and how many of these illnesses are genetic.
Right.
And yeah, it's unfair to the people who keep themselves healthy and stuff like that for them to have to be paid more to help these other people.
Yeah.
But at the same time, there's many healthy people who get something like cancer, and cancer becomes a very expensive cost, and almost all of us know someone like that.
Right. Yeah. I just want to add real quick. A lot of diseases that are commonly known, like obesity, diabetes type 2, cardiac disease, atherosclerosis, strokes. A lot of those diseases are environmental. I mean, we could talk about this on our podcast, and I think we did a nature versus nurture. But basically, what I'm trying to say is, a lot of them, yes, they have genetic components to it, so you're born with what you got, but a large part of them also are environmental, things that you could prevent with diet, exercising, good health, and things like that. So that's just something to know.
And take into consideration also, like epigenetics and the gene activation, the fact
that's what,
our own actions actually contribute to the genes that are activated.
Right. Yeah. Right.
And to our susceptibility towards certain illnesses.
Right.
So this problem that I discussed, where healthy people now have to pay more because sick people, no longer. Well, now they're getting health care, they're guaranteed health care, and they're paying considerably less, is known as rate shock. And in the media, different bloggers will often exaggerate the effects of this. So far, there hasn't been it hasn't been so extreme that's been a problem. In certain states, for example, New York, you've seen premiums on on healthy people go up, but in other states you haven't. And we'll get back to that when we talk more about the individual mandate.
Yeah.
So we're discussing rate shock, and I want to talk about some specific examples where rate shock is occurring. For example, in Ohio, different estimates estimate different amounts of additional prices that healthy people will have to pay in premiums now that sick people must be insured.
Yeah.
So on average in Ohio, the individual coverage will likely increase the cost for a healthy person by 41%. By the year 2014.
Oh, okay.
And Ohio will be an example where premiums on healthy individuals will go up significantly more than other states. So the rates of increase will be very dependent on the specific state and the situation in the specific state. One of the reasons why Ohio is going to see a higher premium for healthy people than other states is because most people in Ohio are already insured.
Oh.
And so what that means is when most people are already insured, the people that are uninsured can't be added to that pool of additional money.
Additional money. I gotcha.
And so that just means that because we're not adding more people to make up for the sick people being added into it, the people who are healthy are just going to have to pay a little more. In states where there are many uninsured people, you won't see a significant increase in costs for healthy people.
Okay, gotcha.
Okay.
Yeah, I just find it very interesting that they use the term rate shock, but it makes sense to me.
So another problem besides rate shock that people are concerned about and is potentially a trade-off is something called a death spiral. The death spiral is a pretty simple concept. Basically, it's when penalties aren't great enough to incentivize people to not purchase the healthcare.
Okay.
So let's say that purchasing a cheap plan of Obamacare costs $1,000.
Yeah.
And not purchasing a plan costs $300 as a penalty. Now let's say that you're a healthy young person, you keep good care of yourself, you still go to doctor's visits on a regular basis, but you don't need this extensive plan. So instead you'd rather just pay out of pocket cash instead of buying into this plan. And so what you choose to do is instead of paying that $1,000 for healthcare, you instead decide to opt out, and you're going to be fined by the government. So next time you get a rebate, the $400 will be deducted from that rebate.
Mhm.
So what could potentially happen if this happens on a wide scale is that all the healthy people that were before going to be pulled together to accumulate money for sicker people are now opting out. So now what's going to eventually happen is
Yeah.
that the cost to the other healthy people who remain will go up.
Oh, yeah.
And it will keep going up to the point where no healthy person buys health insurance, and there's no way to accumulate the money necessary to
Yeah.
pay for the sick people. And that's the concern of the death spiral, and that's something that we really can't tell, how it's going to, what's going to occur until, a few years down the road.
I mean, but couldn't you just raise the penalty to almost the level of cost of
Exactly.
health insurance, and you never run into this?
Exactly, and that's my point. That's what I was going to get to. So, for example, in New York, a similar thing happened. It wasn't completely a death spiral, but prices did go way up for healthy people. Premiums did. But in Massachusetts, where they implemented a plan that was very similar to Obamacare, under Mitt Romney, they actually created this idea of the individual mandate where they required people to get health care and then penalized them if they didn't. And that penalty was significant enough that most healthy people chose to buy instead of pay the penalty.
Okay.
So
the death spiral could theoretically happen.
it's
but
theoretically
not
possible. It's a
likely.
concern and it's a trade-off.
Yeah.
The next part that I think is interesting to look at and plays a crucial role to Obamacare is its effects on large and small businesses.
Yeah.
So probably the most, in the short term, the most detrimental effect to businesses in general is just the expense that they incur through promoting and teaching their employees how to use this new healthcare system. So HR departments, they have to, Obamacare is an overhaul
Yeah.
of the medical system.
Right.
And so every way that they previously gave their employees healthcare is now open overhaul, and now they have to spend money to teach and learn new things. And Obama has been, empathetic towards these problems and has been going out of his way to try to remedy the situation by offering free podcasts on the internet that explain things. Tons of seminars are offered that teach different people who are in companies, and he's trying to prevent too many companies from overspending on adopting this new system.
Okay, so the problem is you're saying that the problem is that basically Obamacare is requiring companies and small businesses to not only provide health insurance but to also educate their employees on health insurance.
Well, it's not that he's forcing them to educate their employees, but because Obamacare is overhauling the system, anything that they previously did with their health care, and because Obamacare is an additional option, is thrown out the door. So companies have to educate their employees because they have to provide health care for their employees.
Yeah, right, okay.
So there's a couple differences.
Sorry, if the company is less than 50 individuals though, I don't think they have to provide health insurance.
Yeah, we'll get to that,
right?
the specific stipulations on different companies.
Right,
I was actually about to jump to that. So there's when we discuss its effects on businesses, we have to differentiate between small businesses and large businesses.
Okay.
So the main roles of small businesses and what makes a company a small business and have to abide by these rules is that a company that is small who has a worker that works over 30 hours must provide that worker with some form of health insurance.
So even if the company had 25 employees.
Well, no, I haven't gotten to the number of employees yet. I'm just saying any of their employees that
work
over 30 hours count towards what you're getting to.
Okay.
And the employee mandate says that employer mandate for 50 or more workers, you have to have 50 or more workers to get into the category of a large
corporation.
company.
And once you are a large corporate, well, you wouldn't want to get into this, right? If you're a company, you would try to stay away from this. Because once you are a large corporation, then you're mandated to...
But you're not a large corporation.
Or a large business.
Sorry. A large business, yeah.
A large business. Once you have more than 50 employees and you're considered a large business, and therefore any of your employees that work 30 hours or more have to be provided health insurance.
Right.
From you, the business.
Right.
Okay.
So another element to this whole thing is that Obama, through Obamacare, wants to open these these shops across the country where businesses can go and negotiate prices. As we talked about earlier, one of the main reasons why Americans spend so excessively on healthcare is because of public hospitals and private hospitals' inability to negotiate with contractors.
Wow. Okay.
And so Obama has attempted to remedy the situation by opening these shops where small business owners can meet together and negotiate prices with companies, and eventually, not currently, offer their employees more choice in which healthcare plans are available.
Okay, so the small businesses guys, they get together and then they talk directly to a health insurance company to work out some sort of deal so that they can pay, the health insurance company X amount of dollars and then they get their employees covered.
Right.
Okay.
So the central idea of these shop exchanges is that they hope to give small companies bargaining power and choices among different plans.
Okay.
And this is actually something that's really good because in the past, small companies really didn't have this power.
Yeah, you couldn't take like a small company and talk to a big shot, health insurance company, because health insurance company is not gonna, it's huge. It's not gonna talk to like some small business. Yeah.
Exactly.
Gotcha.
So those are the main, those are like just the basic points of Obamacare.
Yeah.
And I thought that at the end I'd discuss some of my own thoughts on Obamacare. I'm, I kind of have an ambiguous position at this point, but I want to talk a little bit more, discuss some of the ideas I just discussed now, and talk about maybe potential problems or potential ways that I could foresee the Obama administration fixing some of these problems that do currently exist.
Okay, before you do all that, I think that's good.
Mm-hmm.
Let me just say a couple things from like the health perspective. Like these were business and individual perspective,
Mm-hmm.
but what does the hospital have to do, and what do like doctors and nurses, what do they have to follow because of the changes in Obamacare? And real quickly, it kind of discourages them. It encourages them to do preventative medicine. So at any test that prevents something, you can predict something happening, like the blood test that we talked about for cancer or whatnot. But you can get penalized for doing defensive medicine. So it's no longer the more amount of tests you order, the more money you make.
Mm-hmm.
It's more if you can take care of 100 people, and you're given X amount of dollars. So you might be given $1 million to take care of 100 people for a year. I'm just making up these numbers, and that's it. So you can use your money in any way, but the remainder money is what you collect. So if you start ordering like all these tests that you don't need, then you're ultimately losing money.
Mm-hmm.
But you don't want to. You just can't order no tests, because if someone develops something serious, then that surgery costs you even more. So it's really making the physician, the hospital, and everybody in the hospital strategize to optimize their spending, because ultimately that they take home the rest. So I think that's a good thing, but at the same time, I think it would discourage some doctors from doing the appropriate test, because they want to keep money on the set. I mean? I don't know, it's kind of shady. So shady in the sense that you don't know exactly how it's going to happen, but who knows. So the other thing too is that it encourages hospital competition, because it encourages hospitals to say, come to our hospital, because for each member that they add, the government pays them more money. So if you're taking care of 1,000 people, you get 10 times more money than I do if I take care of only 100 people. But my building is my building. I want to get as many people in my doors as I possibly can. And so hospitals now are starting to compete with each other and buy each other out. So this type of competition may be good or bad, depending on your thoughts.
Mm-hmm.
Anyways, I want to just quickly add
Yeah,
that.
no, I think that's a good addition.
Yeah.
So when we get to my personal opinions on it, one of my general problems in general with the idea of socialized healthcare in the United States is the lack of homogeneity between states. So I just got back from studying abroad in Canada, and among Canada's population, the socioeconomic status tends to be about the same. While in the United States, the disparity between the rich and the poor is much different. We have many more classes, and between states, we have very different cultures. Take Texas for example. Texas actually voted in their state to overturn the individual mandate, which the federal government decided on.
Wow.
And Texas is a very conservative state, while like a state like New York is much more liberal.
Oh.
And so from state to state, we have very different situations. And as I discussed before, for example, Ohio is going to be paying more. The healthy people are going to be paying higher premiums because fewer people are going to be added to the healthcare pool because of the plans. I'd say that the general problem that Obamacare was attempting to resolve was the problem of people with pre-existing conditions. And it's been this issue specifically that people have been trying to solve for years and propose different solutions to. And Obamacare is one of those solutions, and it's been implemented. My thoughts on it are that if pre-existing conditions are the main concern, then we should be open to the possibility that other solutions could fix the problem without overhauling the whole system. So
Yeah.
currently, by implementing Obamacare, which overhauls the whole system, we have to have these companies and these HR departments retrain their employees. Everyone has to learn a whole new list of expenditures, all sorts of different stuff in order to implement Obamacare. So one question and one doubt that I have about Obamacare is that maybe it's too extensive. We have only a limited capability to predict how different things will work.
Yeah.
And because we don't have a homogeneity between states, because each state is so different, I would personally think that if we were to go the route of a socialized healthcare, it should be devolved to a state level so that each individual state can construct its own system that can better fit the people of that state. Because, like I said before, between different states, you have very different people, very different cultures.
But Obamacare is not exactly socialized.
Oh yeah, it's not.
It's,
I'm not saying
yeah,
it's socialized.
kind of as close as you can get to it without being a socialized healthcare
Yeah.
system. Yeah.
We still will have private companies. One of the key points to a truly socialized healthcare system is that the abolishment of private companies and everybody being on a government plan.
Right.
But my opinion is that the success of other socialized healthcare plans is in large part due to the homogeneity that's seen in and within that country. So you have like Switzerland. It's a much smaller country for one, so it doesn't have the diversity of different types of people.
Yeah.
Additionally, it doesn't have nearly the diversity that the United States does.
Yeah. Right. In terms of people.
And the same is true with Canada. Those are two examples that we often consider.
Yeah.
But nonetheless, some sort of plan needs to be implemented to help people with pre-existing conditions because it's a problem. And there have been different attempts to try to resolve this issue without going the route of overhauling the whole system. And one such example is creating pools of people for people who are sick with pre-existing conditions to pool their money together and create a system of that nature.
Wow. Okay, so like all the diabetic type 2 patients would all pool their money together, and amongst them they would like kind of have their own separate bracket of health insurance.
Yeah, you would just pull together those types of people. So currently, like when you work for a company, many companies already do that. They pull the healthcare money together so that even if one of their employees has a pre-existing condition, they still receive coverage because of other people being pulled together. So the idea is that we create more of a universal system that is more attractive and can be easily entered by people with pre-existing conditions.
Yeah.
And that's another solution, but a solution that itself has potential problems too.
Yeah.
So let me.
I think we have maybe like 2 or 3 more minutes.
Okay. Yeah.
So. Yeah, I think it's also interesting too that just with Obamacare, how we've never had such an overhaul before, and I think because of that, people get scared. When rules change, people get scared. When the entire system gets changed, people get really scared. And I think people are always scared of change psychologically. For such a big system overhaul, I can understand why people would be very resistant to it.
Right, and then when I've discussed ideas too, like rate shock and the death spiral, those are potential concerns. I'm not saying that they will come to be. I mean, like I said before, if we make the penalties significant enough where it doesn't incentivize people to not opt into healthcare, then potentially we could prevent that problem entirely.
Yeah.
But at the same time, because each state is very different, we could see instances where Obamacare fails on a statewide basis.
Wow. Yeah.
So, I mean, this is just a very basic view of a very complicated bill. There's a whole another aspect to it when we look into the medical sector and things like that. But hopefully that this is a good introductory of the basic logic of the healthcare, some of the basic concerns, and some of the basic things that it attempts to remedy. And hopefully we can do some more on the healthcare topic eventually. And well, we hope this.
You can have a conversation with somebody about it.
Hope you can have a conversation with someone, and
thanks, guys.
For this. Are you able to like cut out parts where we aren't talking?
I can try to look for it. Actually, we had 8 minutes. I'm sorry.